data is the new oil. Collecting large number of data sets. Hopefully, sorry. Yeah, I switched from collecting large set of data sets from disparate sources, applying models and algorithms to mine the stores of big data, creating insights, and then draw actionable decisions or items out of that, communicating findings to stakeholders via visualization. This is our sort of research forte. Since COVID starting, our Data Science Institute quickly formulated two teams, Team A and B, worked very, very closely with the New South Wales government on data-driven decisions. From early March to July, our teams were on the 3 times a week sprint on data and analytics teams with government, New South Wales government departments such as Premier and Cabinet, Treasury, and New South Wales Health. Let me report back some of the findings here. So government from 188 countries have deployed more than 1,500 different measures to control the spread of COVID-19. This interactive dashboard actually highlights the timing of the government interventions. So if you look at this, the different colors shows various different measures, such as curfews, movement restrictions, partial lockdown, and the pink one is international inwards blocking, etc. And we can pick different country by size, by region, by government type, and different measures. This provides the whole snapshot of various different countries, how effective the different measures they're starting at various different timeline. The bottom line is how many days since the COVID break, and this is y-axis is showing the percentage of population get affected, for example. So this helps government to bring forward-looking information at the relative timing and impact of lockdown restrictions, stimulus interventions, and the easing restrictions for all countries' reported results comparing to New South Wales, allow us to make a comparison to made against the countries similar to Australia from range of different perspectives, for example. This one is showing the social distancing or those measures, how effective it is. So the data is coming from Apple movement, and this only shows a few selected countries. Green one's Australia, and next one is Austria, Canada, Italy, New Zealand, Norway. So we actually plotted all countries. So this, you can see the lockdown measures. So this one is green is Australia, and then this is lockdown starting. Sorry, lockdown starting from here, sorry. Yeah, and then start easing restrictions and movement resume back. The other important thing is looking at not overall average of New South Wales, but looking into details of different LGAs, local government areas, to see various different behavior changes in things like rentals, like a vulnerable cohort, and many others. This is actually, sorry, this is a bit fancy because it's showing to Minister last time. So this is actually one of the reporting cards. We report back to New South Wales government. Sorry for a little bit a busy slide, but this is shows various different tasks we complete and report back to Premier's inside team. This one is in rent changes, and this is a vulnerable cohorts, particularly on the aged care and aged care group. So this is showing the rent changes and the volume changes basically is the people want to rent or the rent on the market. So you see the color change. The darker the color is actually the changes more. So you can look at this is the Sydney area, the northern part has a lot of changes in terms of volume. This is only shows May to February. Yeah, this is around the bus delays. Each of the dots on this one is showing, so each of the dots on this page is actually a bus stop. And the color representing, sorry, it's a bit, I didn't plan the timing well. So the color shows the degree of delays, and darker the color means the more delays. You can see after COVID and the bus delay significantly changed, reduced. This one shows the different socio-economic impact and job reduction of various different LGAs. And the top two are no surprising. One is the accommodation and the other one is the recreation. So these ones shows the combined impact of bushfire and the COVID-19. So some of the areas has got a double hit by the bushfire. So the last one I'm going to show is this one, which is community sentiment coming out of course, the social media analysis. And those Twitter information showed the community sentiment around different LGAs. This is particularly relating to some of the mental health issues. We actually published a paper around using this sentiment analysis to identify the risk areas in mental health. We also published the transport behavior changes during COVID. So to summarize is data science provides a lot of objective assessment of situations and provide data-driven risk minimization decisions. For this case is we provide all those insights and then recommendations to New South Wales government by utilizing UTS research strength. I will stop here and thank you very much.